Hi everyone, my name is Dominic and my health promotion project is called North Shore for Life, and in a few moments you'll see why that is. So just a little about myself. I'm from New York City, specifically Staten Island, New York. It's the most suburban of the 5 boroughs. It's otherwise known as Richmond County, so those are equivalent. Staten Island is Richmond County and nothing else, so that's the entirety of Richmond County. And as you can see from the screen here, there are 3 city council districts. And I'm going to focus on the one that I'm from, which is the 49th district. It's known as the North Shore because, as you can see, it's the northernmost portion of the island. And it is divided here at the bottom by a major thruway. We've got a bridge to Brooklyn here, another bridge to New Jersey there. And as you can see here, just to have some idea, here is Staten Island, and right next to it is Brooklyn and Queens. This little piece here is Manhattan. And if you go way up here somewhere, you've got the Bronx. But anyways, let's continue. So just to give you some idea of what the 49th district or the North Shore looks like, it's about 182,000 people. So just to put that in perspective, roughly the population of Shreveport is condensed into several square miles on the least populated fifth of New York City. So just to give you some idea, it's the most urban part of a suburban neighborhood, if you will. It's famous for having the Staten Island Ferry, which is a free way of going back and forth between Manhattan. You can easily get great pictures of the Statue of Liberty there. And it's also where the Wu-Tang Clan is from. So, for anybody who likes that. And here we have a population demographic. While Caucasian Americans are the predominant subpopulation, there are more Latino Americans and more African Americans in this part of Staten Island than any other. What brought me over to look at it as a potential health promotion project site was that 61% of the population is under 45. This is important because of the particular topic that I'm going to talk about, which is premature death and longevity. So the implementations and the different interventions that I'll talk about, I think, could be very useful because the population, or a good part of it, is relatively young, so we could make important strides in that field. So what I'm about to talk about, which I referred to before a little bit earlier, is if you look at this map, you can see that this is life expectancy, and the darkest color is the 49th district. Even adjacent districts nearby, and then even nearby Brooklyn as well, the average life expectancy is at least a little bit higher. St. George and Stapleton, which is the 49th district, which is the North Shore of Staten Island, I'll refer back between all 3 of those as the same throughout, has a 2.2 year shorter life expectancy than the rest of New York City. The rest of Staten Island is at approximately the city average, or even slightly higher the further south you go. So what gives? I mean, why would an area that's literally next to longer living areas have this problem? Well, that's what I want to talk about. So I'm going to spend the next dozen slides or so just kind of going quickly over some data. This is all from the City Council's annual health report project for community health districts. Every neighborhood in New York has one of these large reports. They're absolutely wonderful. They cover every aspect of public health. The statistics are, bar none, the best that you can find for public health in New York. And if you find yourself doing public health of any kind in New York City, you will most likely refer back to these at some point. So I'm just going to quickly go over these just to give you some idea of what the neighborhood looks like. So here we have St. George and Stapleton, again, the 49th district or the North Shore of New York, and this is premature death. Notice that the rate of premature death, so that is people who are less than 65 years old, is higher per 100,000 people than New York City by a pretty reasonable margin. I mean, that's not nothing. That's not 1 or 2 people per 100,000. And you can see the different reasons as to why that is. Now, notice that cancer death rates are noticeably higher, so are heart disease, drug-related deaths as well. The biggest difference between these two sides is here at number 4, which is HIV-related deaths. It is in the top 5 for the North Shore of Staten Island, but it is not in the top 5 for New York City. So that tells me that the problem of HIV is not managed well in the North Shore of Staten Island. And if you look at the next statistic, Here we have the new HIV diagnosis rate. While St. George's and Stapleton is higher than Staten Island overall, it's not higher than New York City. The problem that there sort of suggests to me is that while the rate of HIV diagnoses is similar to New York City, it's not being managed well because it's leading to a greater proportion of deaths. So that was the first specific issue I wanted to touch on because there is such a big difference compared to Staten Island in general. However, there are other concerns. Anyone who knows much about who knows much about mortality in general will know that infant mortality will severely affect your averages just because you have literal 0 and 1 year olds dying well above average for other neighborhoods. So as you can see, that's the case here in St. George and Stapleton. It is head and shoulders higher than Staten Island and New York City in general, and a lot of these graphs will have the other extreme just as a contrast, so it's much different than the Upper East Side, just in this case is the example. Also, there's avoidable hospitalizations among adults. Now, hospitalizations are an independent risk factor for predicting death. Just by going to the hospital, you are taking a risk. Now, it's a controlled risk because the assumption is whatever is ailing you is worse than what could happen in the hospital. But in the hospital, there could be malpractice, there can be an independent infection, or there can be a worsening of your condition for various reasons. So you don't want to go to the hospital unless you have to. And so the fact that there are avoidable hospitalizations in the adults here, it is telling. It tells us something about the problem that I'm trying to highlight. Also, another surrogate marker is psychiatric hospitalizations. Notice that there is a significant difference between St. George's and Stapleton and the other comparative groups. Psychiatric hospitalizations suggest that there may not be adequate services for prevention up front. Things like anxiety, depression, and substance abuse, which could have been treated more affordably and less damagingly in the outpatient setting, might not have been. And the fact that psychiatric hospitalizations are noticeably higher is not a guarantee, but it is suggestive that that might be the case. Right alongside, I just wanted to point out that infestation of certain bugs like cockroaches is a little bit higher in St. George and Stapleton relative to Staten Island. This is the percentage of households, so that suggests that there is a certain lack of cleanliness or that the neighborhood has a certain lack of cleanliness. So those could also be contributing to that slight difference in life expectancy. Also, notice that there is a lower percentage of households with air conditioning units. Now, air conditioning units are a certain amount of money. They can be up to a few $100s. And the fact that St. George and Stapleton have a lower rate of them suggests that there might not be an affordable option for some of these people. There might be some underlying poverty, which I don't have in the statistics here, but there is a lower annual income per household in St. George and Stapleton compared to the rest of Staten Island. So that's problematic, especially as you get older. Heat stroke is a real health concern, and the older and frailer you are, the more susceptible you are. And every year, people all over the United States do die from heat stroke, especially the elderly. Now, the 49th District is not a food desert. You cannot define it as such. However, the proportion of real supermarkets to bodegas, which serve as quick and easy food sources, is disproportionately high for the area. Compared to the 50th or the 51st districts of Staten Island, this number is relatively high. And even for childhood obesity, St. George and Stapleton have a somewhat higher percentage than Staten Island and the rest of New York City, which means these individuals are more likely to have other health problems down the road, be it heart disease, diabetes, hypertension, and certain types of cancer. So this problem has the potential of spiraling even further out of control if we don't do anything. And also, jail incarceration is head and shoulders higher than New York City in general and Staten Island specifically in this 49th district. Jail incarceration is also an independent health risk factor. There are a lot of things that I'm not going to get into much during this talk that can happen in jail that can severely impact your health. But the fact that this district has a higher representation of jail incarceration is also a problem. And then even non-fatal assault hospitalizations and pedestrian injuries are higher in this neighborhood too. So non-fatal assault, again, hospitalizations are bad for your health, but these people were specifically assaulted, which is not only an immediate threat to your health, but it's indicative of a life stressor. If you're walking around your neighborhood and you know that odds are higher that you're going to get assaulted, you're going to look over your shoulder more often than you would like to, being stressed and concerned that you might be next. I mean, that's a simple way of putting it, but this is the reality that they have to live with. And also for pedestrian injury, these people were run over at a higher rate than in other neighborhoods. You literally can't cross the street without endangering your life, at least a little bit more than other neighborhoods. So this is just painting a picture of what life day to day is like in the 49th district. And it is a little bit concerning. I mean, there's so many different things that I'm showing you that are potentially problematic. Even subjectively, the level of health that they would rate well as an excellent, very good, or good is lower in St. George and Stapleton than Staten Island or the rest of New York City. And at least a small proportion of this problem can be attributed to the fact that adults do not have health insurance at a higher rate in St. George and Stapleton. And they don't go to the hospital or to clinics when they need to, when there is a medical reason. Now, it's on par with the rest of New York City, but it is higher, those rates of uninsured and not seeking medical care, than the rest of Staten Island. So that helps explain why, looking at adjacent neighborhoods, there is a difference in premature death and life expectancy. So when you take all of those things into account, granted it seems like a lot, but it's actually, in my opinion, painting a positive picture, something that's hopeful. If all these little things, which seems like a lot, I didn't put all the data in that I found that could have been used here. When all of that is added up, it's, I don't want to say only 2.2 years, but that's not that great of a difference. And a lot of these things are fixable. They have to do with things like personal life habits and access to services. So this isn't closing down some toxic waste area. This isn't having to clean up the entire water infrastructure of the neighborhood. These are, relatively speaking, small changes that need to be made. And being able to erase that deficit actually seems kind of doable. So this is what my project wants to focus on. It wants to focus on educating people about the little things that they can do to make their lives a little better and maybe hopefully live a little longer too. So I want to emphasize social determinants of health, and I want to emphasize specifically access to services. So these are the two things that we can do that are, I guess, the most cost effective, you could say, to help and try to shrink that 2.2 year difference in life expectancy. So the actual meat and bones of the project is we would present a 2-session program at 2 separate locations. So we would have 4 total sessions that would teach individuals about social determinants of health and what they can do to improve their health and those social determinants at every step of life. Because as you can see, from childhood obesity to infant mortality to hospitalizations throughout adulthood to even dying prematurely, every step of life, there's at least a little thing here that we could tweak to hopefully help improve the health of the community. In the first session, we would focus on the 12 most common social determinants of health, and we would talk about how that plays into this disparity of premature death and how we can hopefully change those things to improve longevity. In the second session, we would emphasize these topics again just because retention is important, and we would have this second session about a month later, so we don't want them to forget, we want them to retain it, and so we would go over that again. But then we'd also focus a little more on personal life habits. This does meld a little bit with social determinants of health, but these are the more actionable things that can be taken care of from day to day. So that's why we would focus on those. And then the second half of the second portion would focus on hooking up these constituents to public health services and insurance and other healthcare services that are available, which, long story short, in New York City, there's quite a lot. You just have to know where to look. Then as another effort to have them retain information, but also to make sure that they're making these actionable changes, we would do 2 follow-ups. Now, these sessions would be relatively early in the year. So we would have a 1-month follow-up, and then as the end of the year was coming in December, not this December, but next December, we would follow up with them again, just to see what sort of changes they've made and to help us justify whether the program is making an impact. I'd like to introduce you to Staten Island's newest councilwoman, Kamala Hanks. She is taking over for Debbie Rose early next month, and so because it's her first term, we believe this program, were it to be executed, could be a good place for her to showcase herself as a new community leader. We would ask her to come to each of the 4 sessions and to give some remarks about what she thinks about social determinants of health, public health services, and lifestyle habits. And these are all things that she's on record campaigning on. So it would be a good way for her to make some congruency with her platform, to follow through with some of the promises she made during her campaigning season. So we see it as a win-win, and we would of course want her to have an opportunity to do this. Little fun fact about this picture: the bridge that's behind her, it's called the Bayonne Bridge. It was briefly featured in the War of the Worlds remake with Tom Hanks. That's just me giving a plug for where I'm from. But moving on. The theoretical framework that I used for this that I thought was most appropriate was the health behavior model. I think this fit in pretty nicely because each of these 6 topics that I'm about to mention, these constructs, do have a place. So as far as perceived susceptibility, we would basically cover all the social determinants of health. Basically, no one's social determinants of health are perfect, and everyone could potentially have it slightly better, at least, going forward with their lives, so we would definitely cover that. As far as perceived severity, well, the topic is premature death, so it's the literal worst health outcome, and it's final. So I think if we frame that correctly with the community leaders that we would use, with the health experts we would use, I think people would feel the gravity of that. As far as perceived benefits goes, a better, longer life, I think, can be one of those points that people don't always take seriously, but I think when contrasting with premature death, I think we would be able to get these people's ears for the 2 sessions. For perceived barriers, none of the things that we would talk about, whether it's social determinants of health, accessing healthcare, utilities, or even just personal habits, are that hard. But there's a lot of them. So the barriers would just be making all of these changes, not simultaneously, but we have to do them over time, just because we'd be asking a lot of our constituents if we wanted them to change all these things at once. So that's the biggest barrier that we could come up with. As far as cues to action, this program would serve as hopefully the best cue to action. And we also think it would be the best way to help develop self-efficacy. So the assumption here is that a lot of these things are simply not talked about very much. Some of the statistics I didn't put in have to do with early education absenteeism, a lower rate of high school graduation, a lower rate of college completion. So we simply think there's a lack of education that is being pursued in this neighborhood. So what we'd like to do is simply educate and demystify the different aspects of health that go into having a long and healthy life. We would also endorse with community leaders such as Kamala Hanks, among others. And then we'd also do follow-up. So hopefully all these things would help nudge them along a little bit, hold their hands and walk them through what can be a very confusing process if you think about everything that needs to be covered. Here's just a sample marketing plan. I'm not really going to go over this. You are more than welcome to pause the video for a few seconds if you want to look at the details of it, but I'm going to keep moving. And here's the general outline. So the sessions will be a little bit different, each of the 2 sessions that are covered, but the general outline is the same. So there would be an introduction, we'd have some fun and zany icebreakers, there would be a pre-test as well as a post-test towards the end. If it's the first session, we would have 1 PowerPoint slide presentation. If it would be the second session, we would have 2, because the first one would quickly review what was done in the first session, while the second session would build on that with the second PowerPoint. Of course, we'd have a food and beverage break. Then we would have them do something a little more hands-on to really, touch and feel their involvement in health. We thought the most important things would be CPR, which we think is very practical, and something that's going on in New York as well as many other cities is opioid overdosing, so we would give them Narcan training at the second session. We would have several community leaders speaking to them. I had several people picked out, such as local physicians, healthcare administrators, representatives from insurance companies, and these would be split up appropriately at the different sessions depending on the curriculum. After the post-test, we would have Councilwoman Hanks give her remarks, just kind of give a feel-good, inspiring kind of talk about why this is important, what we can do, and why it's important for the individual as well as the health of the community. And of course, we'd want to answer any questions that we didn't get to at the end, followed by closing of the session with the project director as well as his or her supporting staff. So thank you very much for listening. This was my presentation, and see you later.